Hello viewers, this is Dr. Isatu Kakay-Diallo coming to you today with a brand new discoveries in health. The topic, monkeypox. The monkeypox, we all know, is now out there, and there are things that we can do to protect ourselves. And in protecting ourselves, it makes sense for us to recognize some of the signs and symptoms of monkeypox. And the visual examples of monkeypox, in a rash form, right? So we're going to go in details as we discuss monkeypox. Salut famudem, Nakusha, this is not Dr. Isatu Kakay-Diallo. I come today with a new topic, a new program. We don't do this program or from time to time I would come with health talk them. We say it matter for we know the signs them, the symptoms them, the way how to protect ourselves we can to monkeypox. So we talk about monkeypox. Why important for we talk about monkeypox? We come to Sierra Leone, we get many people them where they travel from overseas for coming to our country. So as they can do that, we can end up for see some illnesses them where we don't come before. Where then they call smallpox, now then they call this monkeypox. Well, the first that go back to the English language, so now we talk about in a literature form, the didactic form of it, and try for make people understand what are some of the things. Then I will come back, I talk to you, brothers and sisters, we found them, now we country, and even now we live overseas. For now we really understand this disease here, so now we own local time. What in a two language, I wish I get another way for Duam in all the different languages them, because not to everybody no more careful understand, say what this need for do, because if you don't understand the significance of an illness, how bad this problem is, you're not going to understand how you protect yourself, protect your family members and your loved ones. So because of that, I decided, I know say it all come up from me, where it don't happen, but me family them. When I all know say I don't do health discoveries, health talk about things how we protect ourselves, how we continue for make sure say we not get sick, on things and we'll be able for us we are wear mask, stay away from crowd, things like that. We don't do that during the pandemic. Now this is now a different one. This not only the entire world it affect. This is not different parts na the world them it affect. So before them they say pandemic na the whole world, right? Now then they say endemic na certain parts. In Africa, they not put we behind. We did it. You understand? We did it. So let's take this topic now. Let's see what is monkeypox. Viewers and listeners, taking this discoveries in health in the English language, and I'll divert back to Creole, our local language that many people understand in Sierra Leone. So monkeypox is a viral zoonotic infection that results in a rash that is similar to smallpox. However, person to person spread outside the household, and the mortality from the monkeypox infection are significantly lesser than those ones for smallpox. I think it's a good thing, right? Research, vaccination, prevention, and things that we can do to protect ourselves has helped us eradicate so many viruses out there. So the rash of monkeypox can also be similar in appearance to more common infectious rashes, such as those that are observed in secondary syphilis, herpes, simplex infections, and varicella zoster virus infection. So this is what we got from up to date. And with that, if you can see already on the slide, see how this virus is appearing. So the outbreak in a non-endemic region as of May 2022, which is a zoonotic infection, it is an endemic in certain parts of Africa. So that's something that we all recognize and know. And cases outside of Africa hardly typically being linked to international travel or imported animals. However, in May of 2022, an outbreak of the monkeypox in a non-endemic regions was reported and has since involved thousands of patients in dozens of countries. So think about it. So this is not just one-sided, but there are many countries that actually have cases. So most cases have been identified also in men who have sex with men. So close contact with infectious skin lesions, are other ways of getting this infection. Example, during sexual contact may be the likely mode of transmission. So meaning the lesion or blister or rash, is with your sexual partner, and there's a sexual, contact. There's a possibility, a strong possibility for you to contract this virus. So in addition to direct contact with lesional materials or body fluids, person-to-person transmission can also occur through large respiratory droplets. Person exposed to monkeypox should be monitored for symptoms for up to 21 days. In select patients, that is, example, those with high-risk exposures, post-exposures vaccination is also warranted. So that's one thing that we can all recognize and see how we can prevent individuals, family members, friends, and ourselves from contracting this virus. The virology, for the monkeypox is an autopox virus that is the same genus as variola, causative agent for smallpox. So that's why we are saying that, or that's what researchers or virologists are saying. And the vaccine viruses that was used in vaccine for smallpox, or that was used in the smallpox time, is going to be the same. So electrons, these are all different terms. So we don't think we want to stay back and just watch and see. We don't want to go back to those days. We don't want to go back to those days when they had the smallpox. It was really devastating for many people, as you can see. So two distinct strains of monkeypox have been in existence in different geographical regions of Africa. And as suggested by epidemiologists, or the epidemiologic factor, animals and molecular evidence, right? So there was a study done, that is responsible for this particular disease. You can expect to see the DNA genome rising, the possibility that the circulating virus is undergoing accelerated human adaptation. So with that being said, you can see the epidemiology aspect of monkeypox, that was first isolated in Denmark in the late 1950s from a colony of laboratory monkeys from Singapore that were going to be used for polio virus research. During the following decades, additional outbreak of smallpox were in laboratory animals in the United States, as well as zoo animals in different parts. So monkeypox was first identified as a cause of disease in humans in the 1970s in the Democratic Republic of Congo. Geographic distributions are also identified, Central and West Africa. So monkeypox was first identified as a cause of disease in human, again, in the 1970s in the Democratic Republic of Congo. So first time they finding out that this disease or this virus exists, or this type of infection exists in a human, was in the 1970s, even though it was noted in the 1950s during a lab when they were trying to study, research about, polio virus. So after the eradication of the naturally occurring, remember, naturally occurring smallpox, right, in 1977, and the discontinuation of routine smallpox immunization, that is vaccinia versus vaccine, in 1980s, the World Health Organization monitored subsequent human monkeypox cases. The WHO, which is the World Health Organization, was concerned that elimination of the vaccinia versus a vaccinia virus vaccine, which also protects against monkeypox, would lead to increased susceptibility of the population and the possibility of increased incidence of monkeypox infection. There we are. We find this happening 2022, right? So, and these are things with other factors associated with the increased risk of infection, living in forested areas, male sex, and age less than 15 years old. Anybody less than 15 can also, we've seen this in those type of individuals. So the research continues, and in 2020, the WHO reported that monkeypox was endemic in several African countries, including Benin, Cameroon, the Central African Republic. And then also they have the Democratic Republic of Congo, Gabon, Ghana. There was identified in an animal only. In Ghana, it was only in animals. And then Ivory Coast, Liberia, Nigeria, the Republic of Congo, Sierra Leone, a country where I am from, and also South Sudan. These are what was reported. These are the countries that were highlighted, where they found monkeypox cases. From January to May of 2022, most suspected cases of monkeypox occurred in the Democratic Republic of Congo. So with a number of 1,284 cases and 58 deaths reported. This was from January of 2022 to May of 2022. So and we know now, if you're watching this video later on, that the numbers could be more and the deaths, cases will be more as well. But we believe that it makes sense to bring this topic on board. And I just want to highlight few different countries. The United States, for example, back in 2003, there was an outbreak between May 15th to June 2003. An outbreak of 71 cases, unconfirmed, of human monkeypox in 6 states. And those states were Illinois, Indiana, Kansas, Missouri, Ohio, and Wisconsin. And this is what we got from Up to Date. All cases were in young men, in lesbian, and also the ones that, all these cases were definitely in people that are much younger. And then Spring also reported. So all the cases were in young men in Lesbon and the Tagus Valley as well as, Spain also reported several suspected cases around this time. Yeah. So in the United States, on the other hand, the first case was reported with this outbreak on the 17th of May 2022. Although the patient had been symptomatic for almost 2 weeks before being diagnosed with monkeypox. So you see, 2 weeks, that's 14 days, and then we're talking about up to 21 days to be monitored for, right? So, and then you can see genome sequencing results from virus recovered from this patient displayed similarities to other published genomics, in this outbreak from Europe and other related, in Europe, and are related to monkeypox outbreaks in Nigeria that occurred from 2017 to 2018. So incubation period, quick one, it ranges from 4 to 21 days, meaning how long it takes for you to start exhibiting symptoms. And also they said usually monkeypox virus infection usually is from 5 to 13 days, but it can range from 4 to 21 days. Right. So, and in 2003 again, when they have this virus in the United States, exposure, to onset of symptoms for 29 patients, the estimated incubation time from exposure to illness was 12 days at that time. So now we're talking about a different time, right? 2003 to now, it's almost like 19 years, right? So a person with a history of animal bites or scratchy may have a shorter incubation period than those with only tactile exposure. So that again is important, meaning, like for you to know if you've previously been bitten by a virus, your body has recognize something that happened. So, and maybe you've had a vaccination when you visited the health center, and now you being exposed to it the second time, the incubation period is shorter, right? It is shorter for you compared to somebody who has never experienced this. So that recognition of our body is what this is referring to. And also the signs and symptoms, for monkeypox has traditionally caused, a systemic illness that includes fevers, chills, and myalgias. The characteristics, of that rash is important to differentiate from that of other vesicular eruptions, that is herpes, varicella, smallpox. So the rash is what differentiates this particular virus compared to other viruses or that have the same, similar presentations. However, during the outbreak of monkeypox disease starting in May of 2022, some patients have presented with genitalia, rectal, and or oral lesions without initial prodrome, right? So that's something to also keep in mind. And then the prodromal period, which is, it is characterized by fever, intense headache, lymphadenopathy, right? And some of, lymphadenopathy, back pain, myalgia, and severe fatigue, swelling of the lymph nodes may be generalized. So not just one part, you may get lymph nodes all over. So lymph nodes come about when you have, infections, or when you have cancer, or you have some type of illness. The body tries to fight some of these diseases on its own, but sometimes it doesn't happen, So then you talk about, rash, and this. Definitely the skin eruption usually begins within 1 to 4 days, of appearance of the fever, 1 to 4 days, appearance of the fever, and continues for a period of 2 to 3 weeks. So that's where you see the 14 to 21 days, were also indicated. So that's why you continue to monitor patients or individuals with this virus for up to that time frame. Right? So although rashes without a prodrome have been reported in the 2022 outbreak, disease has occurred at the site of inoculation with prodrome, and the numbers of lesions varies, So that's something to keep in mind. In severe cases, lesions can, continue and large sections of the skin. And then, as we continue to see the rash that tends to be more concentrated, on the face, but often develops on the palms as well, of the hands, the soles of the feet. Other sites may include oral mucous membrane, conjunctivitis or the conjunctiva, the anus, the genitalia, as previously stated, in cases reported beginning of May 2022. It was noted, that some patients may present with, lesions located in their genital area or the perineal area alone. So that was again from up to date and based on all different literatures that were reviewed, compiled together. So how does this virus transmit? We've highlighted, for a human for an animal to a human, transmission. The virus is typically acquired through contact with an infected animals, on bodily fluid. So the animal's body fluid through a bite. So if you get bitten by an animal and then you could get infected that way. It can also be acquired through a preparation of bushmeat, that means raw or minimally processed meat that comes from wild animals in certain regions of the world, including Africa. And then in Africa, evidence of monkeypox virus infection has been found in many types of animals, including, rope squirrels, tree squirrels, Gambian pouched rats, dormice, and different species of monkeys. Monkeys and humans are incidentally hosts, right? That can happen, and the reservoir remains unknown, but likely to be rodents from what they are saying. Findings from 2003, the United States, we mentioned that particular outbreak, in Illinois, and then the infected with the infected animals, and definitely there's a severity of clinical manifestations of monkeypox, presumably, related to the level of exposure as well. As an example, so let's see, another from human to human transmission. How do we get how do we get infected with this type of virus? How do we get infected from one person to the other? Meaning we're talking about humans now. So the route, again, human to human transmission, the virus can occur in several ways. Direct contact, spread through, primarily through the sores, or the blisters, or the scabs, or the body fluids. As such, monkeypox can spread during activities that include close contact, personal contact with an infected individual. The mucous membranes, are potential portal of entry. during an ongoing worldwide outbreak of monkeypox that was reported, in a non-endemic country, close contact with infectious materials, from skin lesions, occurring during sexual contact, close intimate contact is considered the main risk factor for accusation of this particular virus. Although most cases during this outbreak have been seen in men who have sex with men, anyone who has direct contact to skin contact with someone, has the virus, can transmit the virus like that. And then we have the indirect contact, through fomites. So as we talked about hand washing during COVID-19, doorknobs, things that, doesn't move, you can get, this virus transmitted. That's why we encourage hand washing, hand hygiene, respiratory secretions, right? And then also vertical transmission, meaning, a cross section of the placenta from the mother to the to the fetus. So there's been study that shows this, and also although the rate of transmission or risk by trimester is not known, but there is a way that you can transmit this virus to the unborn child. So in a report of 4 pregnant women with 1 monkeypox, right? With 4 pregnant women, actually, with all 4 of them have monkeypox virus from the Democratic Republic of Congo. 1 of them gave birth to a healthy infant. 2 of them had miscarriages in the first trimester. So that's very fragile stage. And 1 of them had a fetal death with stillborn, showing diffuse cutaneous maculopapillary skin lesions that is consistent with the vertical transmission. So that's why pregnant women are also at risk. Then let's talk about complications. Several complications of monkeypox have been reported that include secondary infections, bronchopneumonia, sepsis, which is infection of the blood, and also you have encephalitis, inflammation of the brain, and also you have infection of the cornea. Now we're talking about the eye, that we say, your portal of entry, anywhere that you can get infected, the openings of our face, if you can see the eyes, your nose, your mouth, right? So ways of you contracting or getting this, you can have cornea, infection, with ensuing loss of vision. So that can happen. So this is how serious this particular monkeypox virus is, or infection is. The clinical illness can also differ by viral strain, which we've highlighted in the beginning, and it depends. And then you talk about laboratory findings, multiple non-specific laboratory findings can be seen in patients with monkeypox. These include abnormalities, like the white blood cells, the platelets. So like you get in leukocytosis, you get in thrombocytopenia, and you get in hypoalbuminemia, so that can be also affected, as well as the aminotransferases. These are hematological terms, that we see happening, and these are complications. And you need these cells, these red blood cells, white blood cells, platelets, for other functions. Our body needs it, and it protects us. Then we want to talk about a little bit more when it comes to the cases of monkeypox in these non-endemic countries that was reported between the 13th to the 21st of May 2022. We see Australia reporting 1 to 5 cases, Belgium, Canada, France, Germany, Italy, the Netherlands, and then you go to Portugal that reports 21 to 30 cases. Spain also reported the same number and also had a confirmed case. And you have Sweden, 1 to 5, United Kingdom 21 to 30, and the United States at that time was 1 to 5. But that number we know right now it's beyond that, right? So total in May was just for about a week, right? Or, about a week and a half, we have about 92 cases, and there were also 28 suspected cases at that time. So, and then you talk about, the cases of monkeypox in an endemic. Remember, those are the ones where non-endemic, endemic countries between the 15th of December 2021 to the 1st of May 2022. So Cameroon had reported, 25 cumulative cases, and you have Central African Republic reporting 6, and the Democratic Republic of Congo reporting 1,238 cases. And while Nigeria reported, 46 cases from January 1st to April 30th. So this is where things were. And when you talk about the number of people that died with this particular virus or infection, for Cameroon, they reported less than 5, while Central Republic reported the same. But then Democratic Republic of Congo reported about 57 death cases. In the other study, it shows about 58 cases. These are the areas, if you look at the World Health Organization put this out, suspected and confirmed cases, and you can see these different areas that were highly affected. And with that being said, you can see the risk, which country have the highest number. And then the outbreak, again, it's something that's been going on, and we can do something about it. Since May 13, 2022, there are things that we can do in order for us to prevent this. Have been reported by the WHO from 12 member states that are not endemic for monkeypox virus across 3 WHO regions. For epidemiological investigations, this is still ongoing. However, reported cases thus far have no established travel links, we said, before. And then, based on currently available information, cases have been minimal but not exclusively been identified amongst men having sex with men only, seeking care in primary care and sexual health clinics. So they are not the only one that you can see that with. The cases are becoming minimal. And then also, again, as we revise or reiterate the signs and symptoms of this particular virus: high fever, chills, headaches, fatigue, muscle aches, swollen lymph nodes, and rash. And also, these are ways a temperature will be above 38.5 degrees Celsius. And patients should report things like anything. This is like the visual, example of what a monkeypox looks like. So if you look at this, you see something similar like this, please do not sit home, get tested, and so that you can protect yourself, right? This is from the Center for Disease Control and Prevention, and these are another slide showing a different presentation of this particular virus. What can you do? Prevention: immediately try to notify healthcare workers, and that's one thing that is recommended for you from the Center for Disease Control and Prevention and WHO. And you see a new rash, sores, or blisters anywhere on your body, you want to seek medical help to be tested. You have been in close contact with someone who is sick or have a rash, that's something to also notify a healthcare worker or provider. You want to protect yourself and others by wearing your mask, face covering, meaning your nose and your mouth. Keep a safe distance from others, and then also cover any rash blisters or sores. That's a recommendation that in how you can prevent yourself. And when it comes to testing, the method, it doesn't change much, I'll tell you that. Polymerase chain reaction, which is PCR, is the way of testing for this particular virus. You use, like if somebody have a blister or the rash, they'll try to use a swab to send this particular lesion or the mucosal lesion, to the lab for testing, right? So this is one of the ways for you to do. So another thing they said, if somebody have multiple lesions, you want to make sure that you really do a vigorous swab, or brush at the base of the lesion with a sterile dry polyester. So this is something that you can do. So, and also the reason is having a multiple lesions with different appearances are present, 2 specimens is recommended. So somebody have multiple rash, make sure you send 2 specimens so that they can really know what this type of virus is, and they will use it. PCR, polymerase chain reaction. That's the method, and this is how they want to find out about like DNA, and we've known this is like for even the COVID-19 virus, which now we have a better way of testing. The pandemic definitely had its own on us, but this is different. But I believe from previous learning or previous knowledges, I think we're doing better in how we prevent and manage the transmission of certain infections. So definitely prevention matters. You can do this through like the hand washing that we spoke about, mask wearing, covering your nose and your mouth, and also another thing you can do, supportive care can be rendered to you, and as well as vaccination. This particular vaccine is given intradermally, right? So this goes for people that are in the medical field. The nurses would know that when they administering this vaccine, as you can see on the screen, it's different from a subcutaneous intramuscular that you get with certain vaccines. So this particular one is done intradermally. It's something we don't do most of the time. We usually do or use this format or this route of administering treatment when we testing for tuberculosis. So this is something that you're not doing all the time. So definitely it's just a presentation in how the smallpox and monkeypox vaccines were, given to individuals that are taking the vaccine. So if you're at high risk, definitely you want to get vaccinated so that you can protect yourself, protect your loved ones, community as well, right? So ways of protection, it's key in whatever we do. So the take-home message again: vaccination, social distancing, or covering the blister. This is from the New York City Health and Hospitals. Where these handouts. This is all over the hospital for patients and community members to see. And they want, it's very 1, 2, 3. Little flyer that you can see, you can read, and you can try to tell other people about this virus, and you can disseminate it. They have these ongoing lectures, about monkeypox. If you don't know, you call the health department to send you literatures. Trust me, they will do that. So as we try to summarize, it's an infection that typically causes fever, flu-like symptoms, and a rash, and is and it is currently spreading in many countries, as we've spoke about. That includes those of us living in New York City. So this is what the city provided us with, and you have to also cover the rash. Don't forget that. You wear your mask, you wash your hands, get vaccinated. That would keep you away from this virus. So as we've spoke about, people can have complications. So for you not to get to that, do the right thing by protecting yourself. So this is from the Center for Disease Control Prevention, up to date World Health Organization, some information from New York City Health and Hospitals, and also images that can help you see visual content from Google Slides. So I will switch gears to Creole so that I can glance and also highlight this particular content to my fellow Sierra Leoneans that are listening and watching this program right now. And to you, for the English language, I want to say many thanks to you for listening, and I hope we can prevent and protect ourselves from viruses by getting vaccination, by making sure we cleaning doorknobs, we cleaning areas that you don't frequently use, your devices, your tablets, also the hand washing saves life. It's one of the single most effective way of getting rid of infection. So with that, I want to say until we meet again to another discovery in health. This is Dr. Isatu Kakay-Diallo, family nurse practitioner, and I hope you learned something, and I hope you will be able to share this. Salon from them as I be done they talk about this topic now, English, just so that I can review the literature. I just want to go over this now we on local language, quick one, for make we take a look at this virus we then see don't come now the world from May of this year, we don't affect many parts of the world. Then one for know which type of virus this, is similar to a virus we don't happen way back now the 1970s, right? That 10 day it been be so bad off to the point people then be need for their vaccine and then we'll be able to get rid of it. But currently, what we see, they've been stop the vaccine. The WHO stopped the vaccine at certain point, but they've been get concerned. See if they stop them because they can get this type of virus from different uncooked something. Then one already eats bush meat. I have to say that just talk when you eat bush meat, be careful because some of them meats and they get something them we will make you get infection like this one where they call monkeypox, right? Then we get smallpox. People then picking them they get vaccine and everything. So now this one and they call and say monkeypox. So that clearly tell you see something we get for deal with monkey or then bush meat them and things like that. So you want to be very careful because you can get this from one person to the other. Even not to the one within a host. Maybe we go outside there. If you're not possible, we don't let for us here. I'd encourage COVID. That teaching day we not get for able for misa. Really miss them. So I just want to make you understand that you wear mask. If you say you're sick, you stay away from people them. If you say you don't see bump them by your body, you want to wear mask. Make sure so you cover that sore like boil. We boil come up by you. You don't begin see the boil don't begin pull water. Not sit down, just go get tested so that they will know if the virus you get or the infection, they will do something. Another thing I want to let people then know from waiting then say this type of virus or infection, it look like other person will get different rash, like say syphilis. For example, that they don't see people that we don't get syphilis in the past because of that, and also then somebody we don't get herpes, we now like infection or virus on its own. Herpes now virus infection we can get through sexual contact, if you partner get them, you self can forget them herpes, yeah, and then also chicken pox. We always small. We don't get chicken pox. Most of we, not to everybody. Me is the answer. I've been get chicken pox, right? Me and my small brother. I think at the same time we end up forget them. But it not even happen at Salone. I tell I've been travel na Guinea. I end up with that day. But I come now, it don't need my system. So even though that it don't need my system, I get high risk for get shingles. Shingles now something where they come after we done 65, right? So then they even encourage you for get our vaccine day because people that will not been get the vaccine for chickenpox, then risk for develop shingles is higher. A high past the one that will not been get the. I'm sorry. Somebody will not been get the vaccine. in your risk for get shingle high pass that person will be get the vaccine, because the other one na protect himself. You now you get the disease, right? So you get for no say the thing can come back. We come back, then you get for try and get the vaccine. The pain with shingle, funny. I just want patients that we don't get waiting and they go through. So we turn 65, your doctor will recommend and then will say let you do the vaccine. Yeah. So for try you best you protect yourself. Then in case they are so already and find say this not a pandemic this not endemic now some side them, part of Africa, West Africa included, we country Sierra Leone also included, where I will try for read some of the country then, but the Democratic Republic of Congo get the highest case of this particular virus. They may get over 1,200, about 57 to 58 people that wouldn't be reported. This is not the 10 no more in May where they report the number of cases them, where they been get. So again, as we continue for talk to we found them about how to protect ourselves with this particular virus, what we supposed to do for make we protect ourselves. I think that's the key. How we gonna say this particular virus and how we will continue for protect ourselves. So countries in 2000 and this year the World Health Organization will report this virus now several parts of Africa, where we say like Benin, Cameroon, the Central African Republic, the Democratic way I don't mention Gabon, Ghana, but Ghana they only finance animal, so that they different. Them Ivory Coast, Liberia, Nigeria, and also Sierra Leone, South Sudan. So this is serious. Salone with a family self inside and kind of cases there, and we know say we healthcare system not that great. So we really they try our best in how we will protect ourselves and make sure say we not spread them. When say you house you get problem, a leak, you want to make sure say when they come, you try for cover aside them so it not go destroy you, right? So now that analogy there I want for use we can't to we country. We will not say we healthcare system that great, we still they fight them, and we no one for bring something where will cause we more problems. So don't not forget say we for continue for the worst we continue for stay away from people that we sick. Because if you can do that, it stop the spread of this particular virus here. So, the case them where they been reports now this particular country where now the Democratic Republic of Congo, they been report 1,284 cases them. 58 people them been died. This now inside May no more, not to now. For now, say if you go find out the case them boku. Then after which, the first case now the United Kingdom, now they them fena. Right now they didn't be reported, but thank God that time they say not because of travel history, make them be find out about that particular one day, right? So and this outbreak if it don't happen before 2003, if it don't happen in America also, so now something we don't they go and it don't they come virus then it always affects them very difficult for make you go get rid of a virus, because they're very small. If you look at yourself under a microscope for make you really understand them, know how then they act, in terms of somebody's body. It's difficult. People they spend years for learning study a specific virus and how to treat them. We've been just lucky. Then we worked very fast. We come to COVID-19, right? So this outbreak here, so where the World Health Organization report them, we see cases them in different parts of the world, but we not see them all over the world. Some countries they not even been getting, right? But one other thing we're very important before we go to prevention and how you will continue for protect yourself, where you get this particular virus, then say like you they monitor like the time for no say you don't get exposed with them from up to 21 days, right? So the time they range from that point from 4 to 21 days. Remember when they talk about COVID up to 21, but it start from 2 days, right? So let we begin to keep track of who will go, would have been dead, would have been sick, within the person they present with. That way they will begin count for yourself. Before where this thing happened first, now been 5 to 13 days. Now they say they go up to 21 days, and then at 3 weeks. 3 weeks can happen, right? So signs and symptoms and things and where you go begin to see by yourself. For say you get this virus, right? You go begin to feel say you body warm, like it tremble, you know, and also your body then they hurt you because it sound like saying a flu now you get, you know, and then the rash. The rash now they help for differentiate this particular virus from other rash viruses them like herpes, you know, chicken pox or smallpox, because it's very different from that other vesicular virus them or the other type of rash them, right? So we'll not go to that, you know, science word. So what else they say? The rash they help for let them identify. So we get maybe you see we all get smartphone now, right? You can just take picture of the rash just in case by the time we reach to the doctor, let them know. So you know what? Because remember the body, the inside effect, they come, they begin to do your own part, right? So most of the time people then can get, you know, sick for up to 5 days. You know, and the fever is very high, over 38 degrees Celsius, or that is something that can happen. Then we get headache, intense one, severe headache. You know, the lymph nodes then, like if you touch now, so you get lymph nodes then also, you know, sometimes and they, or even under your armpits, you know, now your groin, you know, so like, or then side and they, you can see rash. You can see lymph node. Lymph node are something where they come because you get infection or you get cancer. So that is not just for show, say the body self don't recognize, say something wrong with me somewhere. Because something wrong with me somewhere, I need to do something. So the body they try, but most of the time they not can do well. People that will get good immune system, some of them think they are not can do much to them compared to that person where they on medication for different things them or get very weak immune system. People that will get cancer, where they on chemotherapy, you know. So think about it. So depending on your health condition, they are at high risk for certain things, and also if you're at high risk, what you're supposed to do for protect yourself, I think important in anything where we do. As we talk, people that they get the virus from animal them to human being there, that they happen, right? Meaning if the that animal they bet you can get them. You know, if you happen, we bet you the animal get the infection, you get them, right? So because of that, be careful what you eat. That now one way for make you get this particular infection. Yeah, so and then not eat food them we not cook, we not process well, because if that food they contaminated with this particular virus, then you don't put yourself at risk for that day. Then you get the one who don't see from person to person, right? If this person also you get this boil pan the body, then the boil burst, then you self get skin way cut or you get open sore, you know, you can able forget the virus or the infection like that. So definitely now make what they say for cover. If you know, say you don't find out, you take them now hospital, let them check you, let them do test for make sure say this test here. So now just regular boil or not to this virus. But if you're not in back, you know, let you go able for prevent them or let you able for tap them. Right, they not take them to somebody else. So and also some people that we then can see, say let's say if your partner gets this, you man or you woman or you somebody with when they get sexual contact, get them, you know, and when I get something intimacy happen, definitely you can able for contact this virus, right? So now make where you sick, then they encourage you stay away so that you not go get somebody else sick. You know, another thing where you get to understand, if let's say, you know, the fluid from that person we get the rash, we don't get open wound or not a mouth or something, it kind of you mouth, you eye, you know, you can able get this virus. So now make for cover your mouth, and you know the importance for make sure see the wash and important. So on the mouth then somebody will get the infection, don't go touch her. You know, then you know wash the hand. Then you go back, you touch her. What will happen? Same way what we talk about COVID-19. how to protect yourself, how not for go and begin to overcrowd na one side and then they join and stuff like that. Belle woman, this is important for that talk. As we don't say, people they get them through respiratory routes, meaning if the person cough, sneeze, it in the air, it's possible for you go get this. So that way, now make the mask important. For belle woman, them also they at risk. Then we do a study where then get like 4 belle woman them. Somebody, one of them able for born them picking with no problem, right? Because they've all been get the virus or the monkeypox virus. So the one now, the 2 them, because them they just like the first trimester, we'll say first trimester, now up to 12 weeks of we get belle. So the 2 them they miscarry because that 10 then they very fragile for this particular period for let you not able for carry the pregnancy. And then the one we go all the way to term, we give birth, end up for born the pikin die. Because them don't get transmission from the mama in your own plus, the mama in your own side, it don't cross to the pikin. Yeah, so Lord knows say this is very serious. Complications then, you can even get problem with your lungs, you can even get infection then in your blood. Your brain also will get like inflammation or swelling. We'll say inflammation and swelling, right? And also the infection can go na your eye. If you go na your eye, it cause you for like lost your eyesight. I think these complications they're very, very scary for what we see they happen. And Lord try we best in how we will protect and your blood count, it affects your blood count then also, in many ways, like meaning your white blood cell count, they become very high because you get infection. Then, even your albumin level will become, low, where you need that like a form of protein now your body, and things like that. And also your platelet, they become low. These now different languages them, but like when you get caught, waiting the platelet they really do for you. Now they can rush now the site where you don't cut for let them go. Kinda like it's just like when you take something, you stack them together as like for block the blood for let not the overflow. The body can do that. The body gets your own defense mechanism them for we. Getting your defense mechanism, but sometimes we not able for deal with time. So this one, you could see the different countries and we get this problem from December to 2021, and also this is the map of the world, and let's see who side them being affected. And since this outbreak, we don't see since May 13, 2020, the case, the World Health Organization definitely report them for make we understand them. But don't not forget again, if you experience any of them symptoms, they are so high fever, chills, headache, and you feel tired, your body then they hurt you get swelling, lymph nodes them around your body, like there's bumps them, lastly bumps them around your body, your neck, like under your arm, between you leg, like I would say, yeah, somewhere there between your leg or groin, if you understand that part of me, definitely not for report time, yeah. And any rash will not look normal, like any of them were so. And for try your best, let you report time, let them go do test, let them make sure say you okay, because this stuff we see you ugly. Then you go sit down and for say okay, okay. So don't forget for wasian, don't forget for stay away from crowd we sick, don't forget for cover any rash, blister and sores them, and that way you can report them thing that so quick to somebody when at the health doctor or the person where they work now hospital. They can do the test and then they will let you know now you get. But all look say prevention it really matter now the key, and then they will give vaccine if you know say when you risk it high. I think I recommend say let you take vaccine. Right, so take vaccine because now the same thing that they give where the people that time they people will get smallpox for give vaccine to them for prevent the infection. Me now vaccine advocacy person, I'd always advocate for vaccine. So during COVID-19 I always see where I be the advocate for vaccine, right? This now from New York City Health and Hospital, then your recommendation, they want to let you know say this now something where they cause for make you get headache. We don't talk hate that very bad. Hate go for heart, the rash, the swelling, and the body all they at you. So don't forget say down and day for make you go land. Well, Salone family them. This now that topic we are count to today. Don't forget so we don't do other health talk them. So this I been feel say it be important, even though it can't late, but it better I bring that today. Even when I do live program, I talk about them. But I feel say important for like continue for sensitize, continue for educate. Me brothers and sisters them, me family them, me auntie them, me entire family, or we entire Salone family them, whether you home or you abroad. Now for take care of yourself. Wash your hand, don't forget. Cover you more, your mouth and your nose. If you know say you're sick, go to hospital. Let them find out what's wrong with you. If na medication, then give. But now we can't see Salone. Most of the time you can see people then they just go take drip. They let they do test. You have to do the test. Let you know say this way they go on with me right now. My body where they hurt, the fever where they get. Now something where they need for do something for me, for find out first. Waiting at the problem, waiting they go on with me. Waiting they go on with me. Once they don't able for diagnose you, then we able for treat you the right medication. No say some virus them or some infections them, certain medication not they work for them. Not all drip or all antibiotics. Sometimes a virus you need to treat them with antibiotic. Then get antiviral medications there, right? Some virus that you make let it go on your own. But sometimes the people that can just go and take antibiotics, drugs them, or take drip no more for let them feel better. Oh, I don't go take drip. Most of the time I don't care. But what you okay will do for prevent that? Look, get tested. With something wrong, get tested. Protect yourself. Because if you protect yourself, you can prevent yourself from getting complications. Then we don't talk about pneumonia, right? Your brain, and your blood counts, because the virus it multiply very, very fast. We look compared to bacteria and any other kind of illness. Yeah. With that, I want to say plenty thank you for you take your time for listening to me today, and I hope so with you don't learn from now. So you will take the knowledge, you will take this particular thing where I don't talk to you about, you teach you brothers and sisters and your friends them, people that way you sabi, where you self go now say, what if you see say you get boil now for something. So what till you learn now, we share them, you don't give the opportunity to the next person. So with that being said, I want to say plenty thank you, and I want to say until we meet again to another discovery, in health with me, Dr. Isatu Kakay-Diallo. I want to say tata. And I want to say, have a good one. And stay safe and stay blessed.